So today, I'm gonna react to The Folded Man.
Ladies and gentlemen, can I please have your attention?
Hey interns, I'm Dr. Chris Raynor and I am not your everyday ortho. I make sports injuries, orthopedic surgery, and medical topics easy to understand and entertaining to improve your experience with healthcare. Today for Orthopedic Rounds, I'm going to review a video about The Folded Man, and I'll share my thoughts on the patient's diagnosis and the treatment that he received. Okay. You guys have been after me for a very long time to do this video, so today is the day I make it happen. Before we get started, remember that I'm always here to help you, so be sure to let me know how I can do that in the comments. Now, the video that I'm discussing today is about a man from China, Li Hua. He is a middle-aged man in his 40s who has an extreme spinal deformity caused by a disease known as ankylosing spondylitis. He recently underwent a series of operations to correct his deformity with the hope that he would be able to resume a normal life. The video that I'm reviewing chronicles his one-year journey. I have not examined or assessed this patient, so I will not be providing specific medical guidance or treatment today. Rather, I will be offering my comments on what is being shown in the video. With all of that being said, let's get to the topic at hand. This is going to be a bit of a longer video, so you can use the time points to skip ahead for specific comments. Okay, so the first thing we see here is that Li is able to at least stand independently. This tells us that his lower extremity motor function and innervation is largely intact. It also demonstrates that Li has an intact sense of balance despite his unusual posture and body position. Here, Li ambulates with a wheelchair. This is likely because it is easier and quicker for him to mobilize in this manner. Although he can stand independently, walking is an altogether different issue. A wheelchair is likely also safer for mobilization, given the likelihood of falling or hitting obstacles because of his backward-facing gaze. The alternative solution is to walk backwards while looking between his legs, but yeah, that's not really gonna work. Li Hua was diagnosed with a disease known as ankylosing spondylitis. This is a disease that is characterized by a slow onset of pain and stiffness in the lower back. It typically affects young men between the ages of 15 and 25, but can occur in middle-aged men and women as well. It may be associated with autoimmune disease and is hallmarked by a gradual loss of spinal mobility, affecting the spine and the sacroiliac or SI joints. Depending on its severity, ankylosing spondylitis may become a particularly debilitating lifelong problem, much as it has become here for Li. As a young man, we can see Li with grossly normal spinal alignment in both the coronal, left to right, and the sagittal, front to back, planes. Li demonstrates a hyperkyphosis or exaggerated forward bend of the spine that affects the cervical, thoracic, and lumbar spines. The expected 4 balanced curves of the spine, 2 to the front and 2 to the back, have been reduced to a single forward-facing curve. Also notable are the observed contractures present at both the hip and the knee levels. A kyphotic posture decreases the intrathoracic space, or the space inside the chest cavity, available for the lungs, heart, and intra-abdominal organs. The cramped quarters inside the chest cavity forces these organs to work harder than normal, which can result in increased morbidity and reduced health for these organs and for the person in which they reside. Li is helped by his elderly mother for self-care and activities of daily living. Clearly, with this condition, he requires a lot of assistance in order to function on a day-to-day basis. The narration in the video points out that there are 3 parts of the curve that require correction. These are the cervical kyphosis, or chin to chest, the thoracic hyperkyphosis, or chest to the pubis, and the lumbar kyphosis, or head to the thigh. Correction of the sagittal alignment means correction of the deformities at all of these 3 levels. Generally, the correction of a single deformity is a major undertaking, so correcting deformities at 3 different levels is almost an otherworldly problem. The abnormal curve can put additional pressure or tension on the spinal cord, as this is a soft tissue structure that is suspended within the spinal column. With enough pressure, the spinal cord may not function properly and paraplegia could ultimately result. Correction of this extreme deformity is difficult and quite challenging. An inordinate amount of planning is required to adequately prepare for this type of task. Here we can see Li's physician using 3D printed models to plan the osteotomies, or the cuts to the bones. This helps the team to decide which bones need to be cut and repositioned and at which levels these cuts need to be made. Here we can see Li using an incentive spirometer, a device that is used to help patients maintain adequate inflation of their lungs. This is especially important for Li. Given his reduced lung capacity, I would not be surprised to hear that he was particularly prone to lung-related illnesses such as pneumonia. Hemorrhagic shock, or the loss of large amounts of blood associated with surgery, speaks to the extent of the surgery that is anticipated and to the duration of the surgeries that are expected. Surgeries that are more complex, that involve more dissection, or that are expected to last longer are associated with larger volumes of anticipated blood loss. Additional risks that are associated with this surgery include paraplegia and death. This is over and above all of the other standard risks associated with surgery. The surgical plan for Li has 4 phases. It is not completely clear what the projected timeline for these phases are, but they include: number 1, femoral osteotomies on both sides, where the thigh bone is cut to correct the deformities at the hip level. Number 2, a cervical osteotomy, where the cervical spine is cut and repositioned to correct the neck deformity and allow the head to move. Number 3, a lumbar spine osteotomy, where the lumbar spine is cut and repositioned to allow an upright posture. And finally, number 4, bilateral total hip arthroplasty operations, where the hip joints are replaced on both sides to help Li to stand up. The anesthesia team uses a bronchoscope, or a camera that allows them to look down the windpipe, to assess Li's airway in preparation for the insertion of an endotracheal tube, or breathing tube. Li represents what is known as a difficult intubation, without good access to his airway as a result of his spinal deformities. In this case, Li was intubated using an awake intubation technique, where the patient is kept awake while the breathing tube is inserted. This technique is only used when patients are very high risk for problems with their airway. It is very challenging to perform, and it is somewhat uncomfortable for patients who require it. Intraoperatively, since Li is in a prone position with his face down, the anesthetic team is forced to reassess the patient from time to time under the sterile drapes while he's upside down. During this first case, we can see that anywhere from 10 to 13 surgical instrument pans are on the back table. This is important to note and speaks to the complexity of the surgical case. Usually, only 3 to 4 pans are required for a surgical case, even for big cases such as for joint replacements. Post-operatively, Li's physicians use skeletal traction to hold Li's head upright, since the posterior muscles that normally do this are too weak to do this after 20 years with his head and neck held in flexion. This is required until the posterior cervical fusion heals, providing structural stability to his neck. In this clip, we can see halo traction that is used to hold the head upright, as well as a bilateral longitudinal skeletal traction that is used on the femurs. Correcting the spinal deformity improves the cardiac function because it allows better chest expansion, which decreases the external load on the heart, making it easier to expand and easier to circulate blood around the body. Again, we can see the traction apparatuses for both the legs and for his neck. More importantly, we can see that the patient retains neurologic function in all 4 limbs. This is a serious and real concern given the amount of operative work that will be occurring at multiple levels. As healing of the various osteotomies progresses, we can see Li being weaned from traction to other forms of stabilization, and the skeletal traction for his legs has been discontinued. Successful completion of a complex transformation such as this requires a multidisciplinary team and approach with collaboration between several different services. Services that may be involved here include orthopedic surgery, neurosurgery, anesthesia, infectious diseases, as well as a host of several others. The operations performed here are made significantly more difficult by the osteoporotic or soft bone. Soft bone offers little purchase for fixation of screws, making it more difficult for the implants to hold the skeletal correction. Loss of fixation as a result of loosening implants could result in lower extremity paralysis due to structural instability. At this point, Li is finally able to lay flat after 20 years. All it took was 3 major spinal operations. One of the potential complications after surgery is infection. Anytime that you cut the skin, you offer a potential entry point for bacteria to enter into the body. Unfortunately, Li develops a fever after one of his surgeries. Of all the complications, infection is a particularly concerning cause of fever, especially because of all the instrumentation that is now present within his body. It is best to think of surgical implants as bacterial hotels. Ideally, we want to keep these hotels empty at all times. In Li's case, his infection was successfully treated with a course of intravenous antibiotics. The final operation for Li was bilateral joint replacements for his hips. The condition of his hip joints was not clear. We can't really see this from the 3D CT scan that was shown earlier in the video. Given that he had bilateral femoral osteotomies to improve the alignment of his legs, it is not clear why he needed the replacements. It is possible that the femoral heads may have been misshapen as a result of contractures, or that they were simply arthritic. This would not be totally unexpected given his age. Of all the procedures that he has undergone, these are likely the simplest of the procedures that are being performed. The combined joint replacements were performed in 7 hours. This indicates that there were some difficulties, as typically bilateral replacements would take between 2 to 3 hours. It is likely that the femoral osteotomies and the implants in place already made the procedures more complex. Here Li is wearing a TLSO brace, or thoracolumbar sacral orthosis, for support while his fusions heal. However, I would expect that Li would be required to wear this brace for longer, since it is likely his back musculature is extremely weak after being in a folded position for nearly 20 years. Li uses a walker for ambulation since he is extremely weak and debilitated following his long-term deformity and 4 successive corrective surgeries. If you look closely, we can note a left foot drop, or ankle dorsiflexion weakness, while he is walking. It is not clear whether this was pre-existing from his original deformity or whether this was a complication associated with his spinal surgery. Either way, overall, the result is quite good. Extensive rehabilitation is required to strengthen weak muscles and to regain neuromuscular control of the 4 limbs, particularly the lower extremities. Li remained hospitalized for many months while he completed his rehabilitation. He was away from home for 1 year in total. This serves to reinforce the complexity of the problem that Li presented with. At the completion of the video, 1 year after his first operation, we see that Li continues to mobilize primarily with a wheelchair. At this point, he continues to lack lower extremity strength and overall endurance. It is likely that rehabilitation will be a long-term process for Li, which is not surprising given the duration of time that he was freaking folded in half. The fact that he can now stand and mobilize independently with a walker with relatively preserved function of both lower extremities is a testament to the amazing work that was performed by the multidisciplinary team that transformed Li's deformed body. Thanks for watching, and I will see you on rounds next week. As always, that's been a word from Dr. Chris, not your everyday ortho.
Just like a flesh wound.